Thank you. Thank you very much. Can you guys hear me okay? Good. Do you have a pointer? And can you guys see the screen well? Is that?
Let's turn the light. I need to close the screen in the back.
Before, if I get it, if anybody wants a business card, I have some business cards down here. If you guys want to ever get in touch with me now or later or whenever.
There is a pointer somewhere.
Oh, and it's
Does that help?
screen's going down. Yeah.
Go ahead and start.
Okay. All right. So usually I like to walk around with my lectures, but I don't think I'm going to go up and down these stairs today. So I'm going to stand down here and give you kind of my lecture. Zach contacted me some time ago, and we played phone tag for a while, but he wanted me to come and speak to you guys about raptor medicine and specifically diseases of concern to falconers or diseases that are associated with falconry. And so what I have for you guys today is just kind of a hodgepodge of some of those diseases. Certainly when you kind of peruse the internet and when I talk to falconers, when I go to falconry meets, there's always certain ones that they want to ask you about. Aspergillosis is certainly one of them. Frounce or trichomoniasis, coccidia, trauma, you name it, there's a number of diseases. So we're going to kind of touch on those. And then at the end, if we have time, I'm going to kind of tell you maybe about some diseases of concern / emerging diseases that you kind of need to keep your radar open for as far as dealing with not only falconry birds, but also wild raptors as well. So that's kind of what the lecture is going to cover. Oh, no problem. So to give you a little history of myself, I was born in Gainesville, Florida, grew up in Missouri, in Columbia, Missouri, and actually from the time that I was 4 years old until I graduated from veterinary school, I lived in Columbia. After I graduated, I went to the University of Tennessee and did an internship in small animal medicine and surgery. So if any of you are wondering what you should do as far as if you're interested in zoo animal medicine or exotic animal medicine or residency later on, I always recommend doing an internship, either large animal or small animal, but certainly small animal if you're more interested in the pet exotics. From there, I was always in the exotic animal ward, so I bugged them enough that they had to give me the residency when it first came up. And so, from that point in time until 96, I was in the avian and zoological medicine residency. Finished that in 96, was board certified in avian medicine, and then I've been a faculty member at the University of Tennessee ever since. So I'm a raptorholic, self-proclaimed since the womb. I can honestly tell you that I can't think of a time in my life when I didn't think about birds of prey. That's a picture of me circa 1989 with one of my first red-tailed hawks. I'm a little thinner there, probably about 60 pounds lighter. But this took work, okay? So, hey, this took effort. And I've been a master falconer. I'm a master falconer now. I've been a master falconer for quite some time as well. So I've trained a number of different species. I've raised everything from kestrels, coopers, sharp-shins, goshawks, red-tailed hawks. I've had Harris hawks and many different species. The one species that I haven't flown so far are the large falcons, and I hope to remedy that, much to my wife's chagrin. This season. Once I finished my residency and as a faculty member, of course, I started pursuing opportunities to really get myself deeply involved in raptor medicine. So I kind of had the raptor community or the falconry community to kind of fall back on, but my interest has always been in birds of prey. And so I kind of took some opportunities and traveled around to different countries, to the Middle East especially. But when it comes down to it, I have the opportunity to treat a lot of different species of animals. Everything from mice to elephants, but honestly, I could truly say that I would rather just do birds of prey, and if I could, that would be the case. I almost had that opportunity because I went to the Middle East in 2001, and was applying for a job at the Dubai Falcon Hospital. Actually got the job, came back with contract in hand, but I got back September 10th, 2001. Shortly thereafter, I strolled into the veterinary school the following morning, and the Twin Towers were coming down, and my wife said, "No, you can go. The kids and I are staying here." So I'm still in Tennessee. So that's kind of a brief history of my life as far as what I've done, not necessarily to get to where I am, but I think certainly if you have a goal or a passion, you need to pursue that passion, whatever it is, whether it's small or large, whatever you consider it to be. But it's certainly something that you should always look into. Because honestly, when I come into work, I truly enjoy what I do. I can honestly say, though, the things that do ruin my day are rabbits with facial abscesses and feather-picking birds. Other than that, the day is usually going to be pretty good, and especially if there's a raptor thrown in there somewhere as well, then I'm very happy. My students make fun of me because if you want to see me get excited, then tell me that there's a raptor trapped somewhere in a building downtown Knoxville, and I will literally leave the building to go get it. Okay. All right. You can tell me that there's a lion trapped in a building downtown Knoxville. I'm like, yeah, whatever. Okay. Yeah. Good luck with that. My passion has always been birds of prey. So what are the diseases of concern that falconers always ask me about? Certainly aspergillosis is way up at the top because it's one disease that we still see very commonly in a lot of our birds, not only wild birds but captive birds as well. Bumblefoot or pododermatitis is a big issue. West Nile virus. Interestingly, we didn't see a lot of West Nile virus where I was in Knoxville, and so the falconers really weren't exposed to a lot. And I don't know if you guys saw a fair number of West Nile virus, but we just didn't see a lot. I think literally when West Nile virus was first coming out and coming across the U.S., we saw probably 4 cases. One of them was a Cooper's hawk that you can see here with Anisocoria. That just kind of demonstrates one of the clinical signs that you'll see. Pox virus, herpes virus as well is a big one. I'm always telling falconers, be careful what you feed your hawk or your falcon, certainly when you're feeding pigeon. And a lot of the guys who are flying some of the large falconers feed pigeon because it's such a rich meat, very nutrient dense. But it comes with some problems that you have to be concerned about. Adenovirus is a newly emerging one. As of probably, I say newly emerging, it's really been around for like 10 years, but we really didn't know what to call it until a couple of pathologists actually have put a name to it. Coccidia, trichomoniasis certainly are some of the problems that we talk about. To continue on the list, orthopedic issues, soft tissue trauma or issues, nutritional diseases, crop stasis is still one that I see, especially at falconry meets, because when you get to a falconry meet and you've been flying your red-tailed hawk on squirrels and rabbits, small cottontail rabbits, and then you get out into the western states and your red-tailed hawk catches a large 4.5-pound jackrabbit, well, you want to encourage that more, so you let the bird eat as much as it wants. It comes back with a softball-sized, crop, and then it just can't evacuate all that, so some of that sits in there and begins to rot. Pediatric diseases we do deal with, behavioral diseases, especially aggression. I'd like to think birds of prey are too smart to feather pick, but they actually do. There's evidence of that in the Harris's hawk. And I think Harris hawks are very intelligent and very social. I think when you raise them alone or you don't let them get out and experience some of the hunting and things like they should, then you start seeing behavioral problems. And then what I also see, because falconers tend to most of them keep their birds for a long time, you do see some ocular diseases, and one of the things that we do see are cataracts as well, and how to deal with those cataracts. So we'll start off with bumblefoot. I think we're going to talk about trichomoniasis, crop stasis a little bit, and then get into one of my more favorite, I guess, if there's a favorite disease to deal with, and that's actually tendon repair, because we've done a fair number of those because of squirrel bites. Squirrels are a lot tougher than you think, and they actually end up lacerating tendons. But a lot of falconers in Tennessee hunt them, and I've crossed over to the dark side as well, because that's just the most easily accessed game. I was telling you guys earlier that we have blackberry brambles that, I hunt my hawk on a T-perch, because honestly I can't see where I'm going, so the bird is like 10 feet up above me, and I'm just trudging through, blackberry brambles. My Jack Russell terrorist is getting in there and kind of getting things going as well. I had a Vizsla. Unfortunately, he died last December, but he wasn't too good about getting into blackberry brambles, so he kind of just stood outside and like, yeah, there's a rabbit over there, right there. You might want to go in there and get it. So I actually never really see a lot of the flights, just because I hear the Jack Russell bark, I feel the hawk take off the T-perch, and I just stop and listen, and either I hear it catch the rabbit or I don't, and then when it doesn't, it's trained to come back to the T-perch, so it works out great. So bumblefoot. How many of you guys have had any exposure to dealing with bumblefoot? Yeah, very common. Unfortunately, it's a disease of captivity. You will see bumblefoot in wild birds, but quite honestly, usually there's something that's predisposed them, either trauma, squirrel bite, other prey bite. I've seen birds that come in with bumblefoot with really severe lacerations on their feet, and I suspect that this young red-tailed hawk tried to tackle a groundhog, which is not going to work so well because groundhogs are incredibly tough. And so there's probably some predisposing cause for that in wild birds. But in captive birds, it's a disease of captivity in that we're not providing them adequate perching, size, or substrate. They're becoming obese, especially during the molting period. I don't molt my bird very heavily. In fact, my male Harris hawk that I have now, he flies at 620 grams. I will probably molt him out at about 715, maybe even a little bit lower than that, because a lot of people tend to let their birds get really obese and they're too heavy, and they're sitting on the same perch, bearing the same amount of weight on the same spot of their foot, and you can expect that something's going to go wrong when that occurs. So it's a disease of captivity. We always hear that Staph aureus is the most common organism cultured from those wounds, but you can get any number of organisms as well, just because they're walking in their feces, they're in their perch, they're grabbing their food, there's blood all over their talons, and so you can see a number of different things. Kind of an old classification that we use is giving a number, 1, 2, 3, 4, or 5. It's old in that it's been around for probably 10, 12 years or more. There have been even older classifications, but I still use it because when I'm teaching the students, I want them to understand that if you can classify it, you can actually determine how you're going to manage that case and talk with the falconer or the owner or whoever you're talking to about managing that case. Because not all of these cases require some type of surgical intervention. I love surgery. I was almost went into a surgery residency before exotics. It was either exotics, surgery, or ophthalmology, and exotics went out. But I love doing surgery, so a chance that I get to cut, my students know that we're going to cut this thing. But I don't always try to, because it's easier many times to correct the husbandry rather than going in surgically to try to correct the problem. So type 1 is just kind of diffuse cellulitis of the foot. You'll see a little bit of redness. Depending upon where it is on the foot will tell you, your perch size. If you have a perch that's too small, you're going to have lesions here in the center of the pad. Perches that are too large, where they're actually distributing their weight more out on the digits, that's where you're going to see your lesions as well. And it really depends upon the species of bird as well, because falcons and hawks require different perches. Type 2, you start seeing not only the redness and a little bit of swelling, but you might see some lesions here. Oftentimes, these may be to puncture wounds from the talons, because the talons, if they're allowed to overgrow, actually begin to twist. The way the talon grows is that the outer sheath grows faster than the sheath underneath it. So that's what gives it its natural curve. And there's actually a paper out that describes the correct angle of growth. It's pretty interesting on how the talons actually grow out and what type of angle they achieve. So when they're allowed to grow too long, of course, if the bird lands on a perch awkwardly, it's going to puncture its foot, and you're going to end up with these small lesions. Honestly, these, I don't worry about that much anymore. I used to go in and pluck that little bit of necrotic tissue out and sometimes open these up, but quite often, if you just change the husbandry, get them onto a better perch or appropriate perch size, different perches in the mew, then that will actually heal itself and go away. Not until you start getting into type 3 where you start seeing this really discrete lesion. You've got redness and swelling. You might have a little bit of pus underneath there. And at that point in time, you're probably going to need to do something more than just change substrates and perch size and perch types and things like that. You might have to get in and intervene to some extent with that. Type 4 gets really bad. My students know that I have varying degrees of what I call illness. So there is less than ideal. That's a minor disease, such as like a skin laceration or something like that. And then there's badness. Badness usually means death. Here we're getting to badness because we've got severe lesions on the bottom of the foot. You've probably got flexor tendon rupture. And when the flexor tendons rupture close to the metatarsal phalangeal interface, those are hard to correct. And we actually can talk about correcting those. But those are really hard to correct down here. When they're out here, they're much easier to correct. This particular picture was taken out of Jamie Samora's Avian Medicine, his first edition. So this bird is in so much pain and discomfort that it actually is sternally recumbent now. So it's getting these lesions on its keel. just because the bird just really doesn't want to stand at all. And then type 5, this is one of those cases where this is a great horned owl that probably tried to tackle a groundhog and ended up losing the distal part of digit 3. And so when we saw this bird, the entire foot was just really swollen and infected, and even managing it, getting some of that swelling down, we still ended up with a really bad osteomyelitis. The problem with that, though, is that once that osteomyelitis begins, it begins to actually go up tendon sheaths, resulting in infection not only of the foot itself, but of the muscle and soft tissue farther up the leg. When you get into type 4, type 5, then you're usually considering euthanasia for that bird, unfortunately. So no matter what the type of disease process that we have going on with the foot, the recipe that I use is one that I got from David Rempel. David Rempel was a falconer or the veterinarian at the Dubai Falcon Hospital many years ago, and I asked him to write this report on how he managed bumblefoot, and it's such a great way to approach it that I always use it now, unless it's one that I'm not going to do surgery on. But his main premises are you're going to reduce swelling and inflammation, get all the necrotic tissue out, don't leave any. So if you're going to go in surgically, then do the surgery right. Protect the wound from further infections, promote granulation tissue and healing, and then identify and remove underlying causes. And I should add in there, add honey. I'm a big proponent of honey. How many of you guys are using honey in any of your clinical? Yeah, one of our residents, we had a joke because everything got honey, and we actually were going to do a video of her just like pouring honey all over herself whenever an animal came in. But because of that, I mean, we know that it has antibacterial, antifungal, antiparasitic property, or antifungal, viral, and bacterial properties. And so it's a great wound dressing to get not only good healing, cleaning the wound out, and getting these guys well on their way to recovery. So what Dr. Rempel did is he actually used this hoof cushion. Can you guys see that? I'm not an equine veterinarian, so I just call it hoof cushion. You take two polymers, you put it together, mix them together, and they kind of get a little more stiff, and then you can mold something out of that shapes around the foot, and then you can cut the center of it out to take the pressure off the foot. And so he used this little metal mold that he'd mix the two polymers together, smash it down in there, and he'd get these little shoes that look like this, and that's what he would use to put on the feet. They actually allow the foot to move to some extent, and when I asked him about that, because I always thought, you really want to keep that as sturdy as possible, one of the things he said was that the falconers in the Middle East, even though the bird has bumblefoot, still want to take it hunting. So it actually gives the bird the opportunity to actually capture something, despite the fact that it has this wound on the bottom of the feet. So here you see a bird that actually has the shoes on, vet wrap to keep it in place, protect the wound, and then usually debriding it surgically. I like wet to dries and honey. Once I get a nice bit of granulation tissue, I'll actually try to close that. And this whole process can take anywhere from like a couple of weeks up to a couple of months. So I usually tell the falconer that when we're dealing with a really severe case of bumblefoot, that essentially your bird is going to be out of commission for quite some time, if not the rest of the year, even if it's early on in the season. Dr. Rempel also suggests antibiotic therapy. I love to use the methyl methacrylate beads. You guys use a lot of those at all? Yeah, I like to use those, especially so I can get antibiotic close to the lesion. And when you use those, we actually have a bead-making party. So we mix it up. We get all the students together. I put it into a large syringe, and then I just squeeze out a real long row on this little plastic plate, and everybody gets a little scalpel blade, and you see people just like, doing this. And so we'll make hundreds of them. We actually sterilize them, give them, if you're using gas sterilization, give them a day or so to let that gas dissipate, and then you can put them in the wound. And so we have cephalosporins, we have aminoglycosides, we have penicillins, we have all these made up already so that when we need them, based upon culture and sensitivity, if we're going to go in and debride the foot, then we can actually put them in right after we debride the foot. The one thing that you do have to let the owner know is that these tend to work their way out of the skin. So if they call you and say there's something white coming out of the skin, tell them it's okay. It's just that bead is now working its way out in a sterile abscess. The other thing that he doesn't mention, but I've added down here, is certainly your NSAIDs or analgesics, because, of course, bumblefoot is extremely painful. So you want to make sure that that animal is receiving some type of analgesic care, whether meloxicam, tramadol, or butorphanol, but something to make sure that that bird is not experiencing a lot of pain associated with that. So we mix the beads up, These are some of the recipes. If you guys want a copy of this PowerPoint, I can easily, you can send me a request or something. I can send it back to you, so you don't have to write down all the dosages, things like that. But just know that these are really helpful as far as correcting bumblefoot. So to sum it all up, this is kind of an overview of everything that we need to do, but I'd rather really concentrate when I'm talking to falconers on this aspect. And most falconers are anally retentive enough, so if you tell them that they need a specific perch size for their mew or varying perches, they're actually going to follow up on that and usually do pretty well. Nutrition is key, proper nutrition. I talked about their diet, make sure they're not on really fatty foods. So I personally feed my hawks either 3 to 6-year-old quail because those are the ones when you buy them from like Rodent Pro or something else, they're not the retired breeders that are full of egg yolk and full of fat. These are actually relatively thin birds. Then I also will recommend weanling mice and weanling rats. And in fact, weanling rat is probably one of the best diets that you can give them because it's certainly low and there's not a lot of fat. These aren't the obese rats that you would get and feed. How many of you guys have cut open rats that you've gotten from somewhere and there's just fat all over the place? You don't want that really. You want to have a nice lean animal for them to eat. Space, making sure that there's adequate space for them to, so they aren't jumping from perch to perch, because when they jump, they tend not to open their wings up and they tend to hit pretty hard. Whereas if you give them the opportunity to open their wings up and slow and control their landing, then that will work a lot better for preventing it. And exercise as well. There was a veterinarian, a German veterinarian that was in the Middle East, and his name is Heidenreich, and he's written a book on raptor medicine. And he talked about obesity and exercise, and I think a lot of what he said had some really good credence to it. Then I found this picture of Dr. Allender. So you guys, is he here? No, he's at the zoo. So just to show you what he looked like, I don't know what he looks like now because I haven't seen him in a few years, but does he still look like that? Oh, he's not gray like I'm getting and everything. But that's just throwing a picture there. So we're going to, any questions on bumblefoot as we move into trichomoniasis? Anything? Nope. Okay. So one of the other diseases that I hear a lot and talk to falconers a lot about is trichomoniasis, also called Flounce. Flounce is not to be confused with canker. Canker is candida, and Flounce is actually trichomoniasis. Any bird is susceptible to this, but I think one of the things that came out, Dr. William Mannon wrote a paper that actually just came out in 2014, where he looked at Cooper's hawks, nestlings, fledglings, and adult breeders in Arizona. And it's really interesting because Dr. Mannon has actually been following this population of Cooper's hawks for years and years and years. And he just put out this paper on his thoughts that the pH of the oropharyngeal area actually controls whether or not the bird will develop an infection or not. And so younger birds more commonly develop the infection, but it's because their pH is more alkaline than what you would see in the fledgling or adult birds. So I thought this was very interesting. So if you ever wonder why it seems like younger birds are always getting trichomoniasis more than older birds, then that's probably why. I think in his paper he mentioned that trichomoniasis or the organism liked a pH of around 5.6, something like that. So anything more acidic than that, it can't grow. The other thing that's kind of coming out is we typically used to associate it with T. gallinae, but we're actually seeing T. vaginalis-like organisms, and there's another paper that just came out in 2013 on a nestling bald eagle that actually had T. vaginalis, and the only other report was a bearded vulture out of the Czech Republic that actually had this same organism as well. There are different species that we're starting to see right now. The other thing I would probably add is that typically when we diagnose it, we try to look at clinical signs, of course, when you get a bird in and you see plaques in the mouth. I always test my students. There's about 15 reasons why you see white plaques in the oropharyngeal area, and certainly trichomoniasis is one of them. You can diagnose it based upon clinical signs, but you really need to see the organism. So you got to get a sample of that, warm saline, look at it under a microscope really quickly to see the organism moving around. And then if you don't see it sometimes, or the organism dies before you can actually look at it, then you might misdiagnose or underdiagnose that. So one of the things that's also come out is there's a in-pouch culture technique where you can take a swab from the oropharynx, put it in this medium, and it'll actually grow the organism and allow it to proliferate so that you can determine, if it does truly have it, even though the clinical signs may suggest that it doesn't, or even your diagnostic tests may suggest that it doesn't. But also, we do see lesions in other areas as well as just the oropharynx. So in the infraorbital sinuses in the ears, this is a prairie falcon that I saw probably 9 or 10 years ago that actually had severe trichomoniasis in the otitis associated with the organism. So it's not just associated with the oropharynx anymore and the esophagus. You'll actually see it in other areas. So when you see those cases that have otitis interna or media or a really bad infraorbital sinus, then maybe put that on your list of differentials. Clinically, when you see it, falconers report that their bird's not eating well. They'll pick up the food. It's too painful to swallow, and so they actually just end up flicking it away. So they're hungry, and they want to eat, but it's just so painful for them. And I take that into consideration as well when I'm treating them, is that we want to make sure they're receiving analgesics for this as well, because it's incredibly painful for them. So this is the in-pouch technique typically used for Trichomonas foetus in large animals, but it actually has some use in our avian patients as well, and other species, cats and dogs, and anything else that might get trichomoniasis. But this has been a way to confirm a diagnosis, even though you may not see the organisms. And I'll skip that. Don't worry about the treatment because you can find that in a formulary somewhere. I actually don't even ask my students to remember dosages because at some point in time you're going to think you remember a dose and you're going to make a decimal point error and then you've got a problem. So it's always better to look it up anyhow. Any questions on trichomoniasis? No? Okay. Coccidiosis, we'll kind of breeze through this as well. Certainly there are a number of different species, but one of the more common species that I see trichomoniasis in, coccidiosis in, are some of your smaller species. Falconers that have sharp-shinned hawks and Cooper's hawks, and this is a merlin that I flew a couple of years ago. Didn't have coccidiosis, but I do see it in merlins when they come in or if I'm at a falconry meet. So it's a disease that they certainly can get. Raptors are thought to be the definitive host, and you do have a number of intermediate hosts, but when it hits raptors, it can be either one asymptomatic and you never know that they had it, and it passes through and the raptor goes on and looks fine, never has a problem, or you can end up with pretty severe disease where they actually have bloody stool, even culminating in death if you don't catch it early enough. So this is just a picture of what you might see. I think this is out of Jamie Simore's book as well. I think this was potentially a merlin that had really hemorrhagic diarrhea because of coccidia. So it can be a pretty severe problem if you don't catch it early enough. The other thing that I put on here is that when you see it, it may be suggested that there's something else going on, that you might need to delve a little bit deeper into that particular bird's health to make sure that there isn't some underlying factor that's leading to why this bird has coccidia. Number of the clinical signs that you see, again, they can be asymptomatic, but progressing all the way from lethargy, depression, diarrhea, even to death. And this is, when I was in the Middle East, this was a bird that had coccidiosis, and it was putting this feces out like this about every 5 minutes for this particular bird. It didn't start out hemorrhagic. It looks like a really brown, like almost coffee grounds and things like that, like it was higher up in the GI tract. But by the end of the day, it was hemorrhagic. And I think that was a Saker falcon. It didn't die, but it looked like it was about ready to reach into the side of badness and move along. Diagnose it. Certainly, you're going to try to identify the organism based upon fecal sample and be able to identify the organism. This is Caryopsera here, which is probably more commonly seen, at least for me, than others. But you can see any number of Eimeria, especially as well. And then that's just treatment. Again, don't worry about that. Questions on that? That was a whirlwind tour of coccidiosis. No, I want to make sure I get through everything. So golden eagles are my favorite bird of prey of all. Had a chance to go out to Amarillo, Texas, and watch a friend of mine hunt his golden eagle on jackrabbits. And if you've never seen a golden eagle fly, if you've just seen them soaring around and they look really, kind of slow and sluggish, They are not slow and sluggish. They are incredibly fast. And then this is up here because this is my favorite arthropod of all. Everybody knows the hippoboscid flies. Who hasn't worked with a hippoboscid fly? Everybody's had hippoboscid fly experience? No? There's some people like, what are you talking about? They're flying ticks. You'll see them a lot on pigeons. You'll see them on hawks. I especially see them on great horned owls a lot. And they come in and they slide in and out of the feathers. But when the bird is teetering toward badness and the body temperature begins to go down, they start abandoning ship. And unlike other arthropods, they aren't afraid of you, so they actually come and land on you. And if you want to see one of my residents will do a dance, I will not demonstrate it for you here today. But when she gets them on her, she will like drop everything, and she goes to start shaking her head and running around. But they're hard to kill. You can't just go, there now, you're dead. You have to actually put some effort to them. And one time I came in, and we had a great horned owl that came in, and I walked into the ward the following morning. It came in on emergency. There was like blood spots all over the wall, and this is where 42 of them had abandoned ship from the great horned owl, and the intern and the students had gone around killing all of them on the wall. Which I tell them to do. I wish they had cleaned it up, but last thing you want to do is have that. Can you imagine this hippoboscid fly getting onto a white cockatoo in your ward? If you want to see some excitement when you send that home, then try that one. So viruses, I'm not going to talk about pox virus or paramyxovirus, although paramyxovirus is very interesting, especially if you're considering exotic Newcastle disease, because vultures, which I would expect, but then great horned owls, which I wouldn't expect, actually can consume infected animals, but not shed the virus. And I'm not sure, I haven't figured that out yet. But they actually will not shed the virus, whereas others will and show clinical signs. But great horned owls, probably because they'll eat anything, and vultures because they'll eat anything as well. Probably their immune system maybe is primed and ready to go. Herpes virus is a problem that I do see from time to time with some of the falconers that I have around me, but it's a big concern because it's one of the soapboxes that I get on when I tell falconers don't feed pigeon, that you don't know where it came from to your falcon. Because the herpes virus that's associated with pigeons, pigeon herpes virus 1, is actually the same virus. It just gets into the falcons and eagles and owls, becomes more virulent, and causes really severe disease and ultimately death. You guys are too young to remember Pacheco's disease, but maybe you've heard about it in a lecture. It's a herpes virus that, say you have a nice, healthy Amazon sitting in your house, and you bring in a conure species. Patagonian conures were thought to be carriers of it. And they're in there together. You don't quarantine them. The conure is sitting there looking happy and healthy, and then within a few days, your Amazon parrot starts looking really weak, lethargic. Within 48 to 72 hours, it's died, and it's died because of this really severe, liver lesions, multifocal hepatic necrosis. Well, the same thing can happen if they eat pigeons that actually are infected with pigeon herpes virus 1 with several raptor species, is that you do see really severe injury to the liver, vascular system, blood vessels, and things like that, ultimately leading to death of that particular bird of prey. So these are some of the diseases that you'll see in the literature: inclusion body hepatitis, falcon herpes virus, hepatosplenitis in owls, and an eagle herpes virus. And we actually just had a case where someone sent us, just had probably a year and a half ago, where somebody sent us some tissues from an owl that was actually infected with owl herpes virus. So the key is, I tell falconers, don't eat the pigeon. Don't let your bird eat the pigeon if you don't know where it came from. A lot of falconers, especially if they're flying the large falcon breeds, the peregrines, the gyrfalcons and things like that, actually will raise their own pigeons to help train. But even then, I tell them to be very leery, because when you take your pigeons out for a training run and you take them 200 miles away and they're flying back, and they're in a group, and then this other wild pigeon that's like kind of sputtering along is like, hey, where are you guys going? Let me kind of get in the group, and shows up in your pigeon loft, then you've got a problem. And so I tell them, don't feed it if you can help it. And they'll tell me, well, we freeze the pigeon. And I'm like, well, freezing's great. You'll kill the trichomoniasis in about 6 weeks. You'll kill the other organisms and bacteria in less time than that. But what better way to preserve pigeon herpes virus than actually freeze it? So when you freeze it and then you feed it, then you're actually contributing to the problem. Most of the time, they never listen to me. until this happens. And so this is a young peregrine falcon that ate an infected pigeon. Because it does cause liver disease, you do see bilivernuria. I don't know if you guys can appreciate the bright green color to that, but you will see that. So when you see bilivernuria, it's really only because of a couple of reasons: starvation or not eating enough, or liver disease. And so you've got to consider those as two possibilities. Clinical signs are this, if you could describe this in a nutshell: lethargy, depression, progressing very rapidly to badness within about 48 to 72 hours. You'd get a smattering of other diseases or other clinical signs that show up, but quite honestly, the falconer may say, my bird is looking lethargic this morning. I'm going to go to work. I'm going to come back and check on it. When they come back, the bird is now sitting on the bottom of the mew. They call you to bring it in. You're trying to figure out what's going on. You're providing supportive care. You're running diagnostic tests. By the following morning, the bird is usually looking really, really bad and probably will die within 12 to 24 hours after you originally see it. So it's not a good disease to deal with. It carries a really poor prognosis. The morbidity can be pretty high. Mortality can get up to 100% in most affected birds. You may have some survivors that may potentially be carriers, but I have yet in 22 years seen one that survived from a definitive case of herpes virus where we've taken it to pathology, and pathology has given us a diagnosis. So the prognosis is really, really poor. And this is what you're going to see grossly. You're going to see the liver here. You're going to see these little white spots of multifocal hepatic necrosis. For the pathologists in the room, I'm not a pathologist, but this is badness right here. This is good, this is bad, and this is a close-up of badness. So it's all multifocal hepatic necrosis, inclusion bodies, and the prognosis, like I said, is extremely poor, and they just don't survive. At least in my hands, I haven't seen any that survive. Therapy and supportive care. Supportive care is going to be the key. People have tried acyclovir, especially if you have an outbreak in an aviary, a falconer's breeding chamber or something like that. People have tried vaccinations, but the vaccinations they don't provide lifelong immunity. In fact, immunity really is only about 8 weeks or so with some of the vaccines that you give. And then, especially when it hits unvaccinated populations, it's pretty severe. Unadapted viruses can overwhelm the immune system pretty quickly, so there's really not much that you're going to be able to do if you have this problem, except to certainly isolate the bird if at all possible and provide some type of supportive care. But quite honestly, it's way on the side of badness when it comes down to it. Any questions on herpes virus? Yeah. I've never tried it. I haven't tried it yet. Typically, I've tried acyclovir in probably half of the cases. None of them have made it. And otherwise supportive care, but I haven't tried anything else. What's the efficacy in cats? You know? Not very high? No? So badness again? Any other questions? So moving on, aspergillosis is actually my favorite disease, and I'm not sure why, except that it's kind of an insidious disease that by the time you diagnose it, unless you know that there's been an event that's led to a possible infection, it kind of sneaks up on you a lot. So I do see it at falconry meets where it's come on pretty quickly, because when you head out west, where most of the falconry meets are, California, Arizona, Nevada, Texas, Colorado, some of those environments at the time that you're there are very dusty. Amarillo, Texas was the last one I went to, was actually kind of dusty when you're walking around, and so the birds are exposed to it. You're exposed to it now. You're breathing it in. Your immune system is able to handle it. But sometimes when you put a bird into a car and you travel 18 hours, or you put them on the plane, which is what I do when they travel down in cargo, they can get pretty stressed out and predisposing them to any number of diseases. So aspergillosis is one of the more common ones that we kind of experience. Trauma, when your bird gets hit by another predator, is another common as well. And then nutritional issues, because people get to falconry meets and their bird is at a certain weight and responds really well, but they want it to respond even better, so they inch it down just a little bit more in weight, and then they inch it down a little bit more because You know, you're there at a falconer meet. You want your bird to perform. You want your friends to think that you're a good falconer and your bird's catching game. And so sometimes they push the envelope. All that leads to stress on the bird. And so either you're going to see it at the meet or shortly after you get home, because again, you stress it by putting it back on the plane, back in the car, or wherever you're going for another 18-hour event. And so that all just culminates in this really stressful event. Because it's ubiquitous in the environment, they're breathing it in, their immune system can't handle, and then you start seeing clinical signs that are associated with it. So you would think with aspergillosis, the most common clinical sign is going to be open mouth breathing, but the first one that I typically see is going to be depression and lethargy. So the bird's coming back from a falconer meet, and the falconer says, my bird just seems really lethargic. I'm like, you need to get him in now because we need to take a look at him. Then, once it's well progressed and you start seeing either granulomatous disease in the lungs or air sacs or tracheal granulomas, then you start seeing the open mouth breathing and severe problems. If it's later on, you might even see emaciation as well. So you guys are probably, although those of you who have worked with birds of prey probably know this, that the more common species that we see affected by it are goshawks, gyrfalcons, and red-tailed hawks, especially juvenile. But there are certainly others. In the literature, you'll see golden eagles, bald eagles, rough-legged hawks, ferruginous hawks as well, but any bird is really susceptible to it. But these are kind of the poster children for aspergillosis. And this is actually not a complete, this is a gyr prairie, but I didn't have a picture of an adult gyrfalcon, so you would never know if I didn't tell you, right? So I'm just being honest. So that's, those are the three common species that we see. Many different ways to classify it. People differ. This is the way that I like to classify it. I have an acute form where they're exposed to a high number of spores. For example, a friend of mine actually shipped his bird alive to me because he lives in Wyoming. The bird lives in a mew. His next door neighbor was plowing his field. Dust was blowing across the mew. Shortly thereafter, the bird developed respiratory signs, and he sent the bird to me, which is stressful in itself for me to treat. This, unfortunately, is the picture of that bird. You've got these severe granulomatous disease that actually progressed, probably developed within about 5 days, so very quick exposure. So the spores, he just must have been breathing in dust for that particular bird. So you see a tracheal form, like here you see the granulomatous lesion in the trachea in this red-shouldered hawk, where you do see this buildup. The air turbulence changes as it goes through the syrinx, so in the literature, they always say the spores fall out in the syrinx, and that's where they begin to proliferate, and you get white blood cells migrating in, and that leads to granulomatous disease. And so these birds come in, acutely dyspneic and open mouth breathing, wheezing, the change or loss of voice are the things that you typically see as well. And then there's a systemic form that you don't commonly see, but it's been reported in the literature. Have you ever seen any systemic cases? Okay, so you've got some reports here. Dr. Greenacre, my colleague, wrote an article on black palm cockatoo many years ago, but you will see some extension either hematogously or through air sacs in the different organs, so it is present. So that's how I classify it, but it can differ between people. That is a picture of me out in Utah, 1998. This was my second Harris hawk, Jesse. All my Harris hawks are either like Jesse, Jester, Jeter, something with a J. I don't know why, but that's a jackrabbit that experienced badness underneath there. And then I don't know why the grin. Maybe it's the raptor in me. It's a stare. So these are the clinical signs that you're going to see. Again, depression is probably more common. Dyspnea, change, or loss of voice. Certainly, anytime a falconer says that his bird is trying to scream and can't scream, or the scream doesn't sound the same, I'm like, you got to get him in now so we can begin to work on this. This is a lot on the diagnostics, but I could probably sum it up to say that you have to see the organism, culture the organism, or otherwise identify the organism in tissues that you are concerned about. So endoscopy for me is the way to go. I'll actually progress to endoscopy very quickly and try to get biopsies and cultures. People will do, I know at the Raptor Center in Minnesota, they used to, I don't know if they do anymore, but one of their entrance protocols for pretty much any bird that came in was that they would swab the trachea and either do like a cytology or a fungal culture. The one thing that I have to question is that if you get just a few colonies of aspid, does that really mean that the bird has aspergillosis? and it's hard to say that. So I like to get in either lung or air sac, identify the organism based upon culture, cytology like this, and base my diagnosis off of that. This is a classmate of mine, and here in the Middle East. There in the Middle East, this is actually a Saker falcon, and they would do this interesting flight test or breathing test, and they would actually take the bird on the mangala, take the mangala out, which is like the glove, make it flat for just like 10 seconds and put it back on it. Then they would just set the bird on a counter, and if it recovered in about 5 minutes, it was okay. If it didn't recover in 5 minutes, they would actually take it to endoscopy and scope that bird right away. And I've kind of adopted that as well. I'm pretty quick to get in and scope these birds. Treatment, antifungal medications, usually going to be long-term, but certainly supportive care, oxygen cages and things like that as you're doing your diagnostics. If it has a tracheogranuloma, I'm going to put in an air sac cannula pretty quickly and leave it in for 4 to 5 days while I'm giving it treatment. And they usually will respond fairly well. But I always tell the falconer the prognosis ultimately is very poor. I never give a good prognosis for aspergillosis because when you say, oh, yeah, it's fine, we're just going to give it itraconazole, or we're going to give it voriconazole and everything's going to be fine, then that's when you usually come back into your hospital the next day and the bird's no longer with you. So these are the drugs that we use. Fluconazole for privileged spaces. Voriconazole I like to use, although one of the things that I'm considering, and I don't know if you guys are seeing it as well, is that we've had a couple of cases that we've put on voriconazole, and voriconazole was developed for a human invasive fungal disease, but the birds aren't responding to it, and they're definitively diagnosed as ASPR, but they get better for a short time, and then like 2 or 3 days, and then they get worse, and some of them actually die. And I think what we're seeing, and they've seen that in human medicine, is that you're seeing resistance even to voriconazole. I'm seeing a lot of cases that don't respond very well to itraconazole, and so you have to treat them for a long time and use combination therapy. But we don't do sensitivity patterns, I think, like we should in avian medicine, because I think that I'm seeing a lot of cases that just aren't responding, probably because of resistance that can develop. These are some of the other things that people use. Terbinafine, you'll see people use terbinafine quite often. I usually try to combine it with an azole because there's some synergistic effect there. Enoconazole, posaconazole, or newer ones as well that have been out for like the last 5 or 6 years, maybe a little bit longer. So there's a lot of options for you to use. The key is you want to definitively diagnose it as early as possible, get them on a specific treatment regimen, minimize stress, correct their nutrition, correct whatever underlying problem it is that they're experiencing, whether it's a fracture or something like that, or even husbandry related, and then treat them appropriately, and hopefully they're going to respond really well to therapy. There is some alternative integrative therapy that's been suggested as well. I'm not going to discount it because I actually use a lot of alternative integrative therapy in many of the cases that I treat. But the thing that people are touting now, and it's going around the falconers like wildfire, is that birds with aspergillosis, if you just put them into an enclosed box and get some pine needles and warm the pine needles up and distill them, the vapor is actually going to kill the fungal organism. There's some truth that pine oils actually do have antifungal property, antiviral, antibacterial properties. However, some of these cases I question as to whether they were truly positive as aspergillosis cases or were they just a bird that had a respiratory problem, because none of the ones, and I've talked to the guy that actually has been a big proponent of this, and he wanted me to help him do some research and things like that, and I was like, yeah, I just don't have time. I think there needs to be a little bit more evidence-based medicine to that. Have you run into anybody that's wanted to treat with pine oil? Yeah. I think if we can get some science behind it, I think I'd be more than happy to really jump on board, and I'm not going to discount it altogether, but I think we just need a little bit more science and evidence-based medicine that it's actually going to work. And I think I've been talking too long. I'm probably going to run out of time here. Any questions? Oh, yeah, I'm fine. I can talk for hours. Yeah. Thank you guys for coming. Appreciate it. Should we wait and see how many are still left? Okay. Yeah, I could keep going. So if you want to hear a little bit more, please stick around. Again, if you guys, my card's down here if you guys want to. Yeah, thank you.
Externships?
Oh, we do. Absolutely. Come on down.
Yeah, so University of Tennessee,
Yeah, if you send me an email,
right?
and then I can get you in touch with the person. Sure, sure. I can get you in touch with the person that helps to kind of schedule that.
Okay.
Because actually, Dr. Allender came down and did an externship,
Oh, okay.
and so we kind of kept track of him and say, hey, we'd like for you to come back for a residency, and so you never know what'll happen, but
Yeah, cool. I would love to do something like this.
okay. If you're looking for cards, I have more. Yep.
Thank you very much.
Sure.
Hey, so I was actually at one of your lectures at the symposium at UCK.
Oh yeah. Yeah. What's your name?
Amanda?
Amanda.
Yeah.
Nice to meet you.
Nice to meet you too.
Yeah. Cool. I think they're all going to be gone.
I have a quick question.
Yeah.
So we're thinking about doing research into evaluating aspergillosis with CT in a live format or a wake format. So we're going to build a chamber, allow them to perch in this chamber and stay still, and try to see if that would be a proper modality to evaluate, say, aspergillosis, or really anything at this point.
Are you going to like give them aspergillosis,
No,
or are you going
we
to?
would want to find a population and see if they have it, and but a prevalence, like whether that population of X species or whatever would have it. We're talking to Brookfield Zoo right now about it.
Right.
Do you think it would be useful in monitoring the progression of the disease? Because it sounds like as far as diagnostics go, you just go to endoscopy. So you don't really use imaging to diagnose aspergillosis.
Yeah, because I mean, you can get a lot of different granulomatous disease. I like to actually get a piece of it, but if you had a population that you knew had aspergillosis definitively, then yeah, you could probably use it to monitor.
Yeah, so I mean, like, so say you're in a zoo or whatever, and you know that, like, some penguins have Asper, and you're treating them, and instead of wondering whether the treatment's working, you can just grab them real quick, send them to the CT, no stress, no sedation,
Yeah.
get an image, evaluate how it's progressing.
Well, especially if you 64 slice spiral CT. I mean, you can run that in what 10 seconds.
Exactly, and so it's very low stress for the patients. If you think it would be worth it for the zoo to, like,
I guess it just depends upon the cost of the CT.
yeah, and the Dr. O'Brien's who I'm working with on the imaging here, and he said that CTs are like nothing they can get donated. I don't know, that's them. But as a zoo veterinarian, do you think that would be something valuable as a monitoring of the disease?
Oh, I think so.
Okay,
Yeah,
cool.
especially in penguin. If you have a big penguin
Yeah, and
population.
So that's what we were hoping for. We're talking to Brookfield Zoo right now, and I just don't know. Do you think that the study would be if we had multiple penguin populations that we looked at? Because I know there's another zoo down here, Scoville. I don't know. I mean, do you think it's something to look into?
Yeah, I think you just have to get a definitive diagnosis and then be able to see lesions on the CT and then follow up with. But I think it would be worthwhile because if it's something that you don't have to catch them up, you don't have to scope them again.
Exactly.
You know,
Scope,
you don't have to
won't
do
have to sedate. You would
right.
just put them in a box.
You just
let them
pick
go.
them up,
Yeah, and they'd
put them
be
in a
fine
box.
sitting there. Yeah, and especially for the raptors too, they'd have a perch. Do you think as a single study I could look at penguins and then also maybe raptors and put it together, like multiple species identification, or should I stick with one species?
I'd probably stick with one species because it'd probably be easier as far as overall numbers.
Okay, cool. Thank you.
Yeah,
Good to know.
cool. Oh, good idea. Is this the remnant?